So welcome everybody, whether you are joining us live or you're watching this video, thank you so much for being here. I think most of you know my name is Rachel Justice, and along with Jillian Levinson, I am the co-leader of Women to Women. And this group, this wonderful, thriving group, is actually my opportunity to sit back, relax, and enjoy the show because the group was created and is really spearheaded by our incredible survivor volunteer, Audrey Carlson, who is here. And we are so grateful. You get amazing speakers. You have amazing topics, and you do it with such passion and grace. And we are just lucky to have you as part of the community. And I'm going to turn it over you to introduce Dr. Marisol to us and to tell us about this topic, which is so interesting. And just want to make sure that you all see there already is an attachment with some really helpful information in the chat. So it's already been placed there. So we will be going over this information, but I just want to make sure everyone notices that it is there. And again, for those who are watching this recorded, actually all of the slides and this attachment will be attached at the end of the video. So thank you, Marisol, thank you so much for being here. And Audrey, thank you for all that you do for our thriving groups and just this wonderful community that you've helped create.
Well, I want to thank you for doing all the work that you do for Woman to Woman, because without you, the thriving group wouldn't exist. So a big heartfelt thanks to you and all the work that you do tirelessly. And another giant heartfelt thanks and love to Marisol, who is a tennis friend, a wonderful friend, who wears many hats, who has inspired and motivated me for a number of years, not so much with her determination in the world of sports, but her world in medicine. She is a teacher. She is an amazing motivator. She continues to reinvent herself on many levels. And Dr. Marisol Cruz Melendez Ostroff, she's a nurse, she's a PhD educator, diabetic educator specialist. She's going to speak about WellBetic, a business she has recently launched, but has been doing this for many years and has it polished and honed just for us today. So whether you're newly diagnosed with diabetes, supporting a diabetic loved one, or simply looking to improve your health and mindset, this informative and educational session is designed to empower you to live your best, healthiest life with holistic education, real support, and positivity. So rather than having me speak anymore, I'm going to hand this over to Marisol. I'm going to mute myself just in case my doggy barks when the mailman comes, but I'm right here. And Marisol, thank you. You've got the floor. Thank you.
Thriving Woman to Woman Conversations. I'm delighted to be here, and I wanted to give a heartfelt thank you and shout out to Rachel, of course, from the Mount Sinai Hospital in New York, and my very good friend, my dear friend, someone who I want to emulate every day of my life, Audrey Carlson, for the kind invitation to participate in your Woman to Woman gathering. It's really just such an honor. So thank you for having me. We're going to talk a little bit about diabetes mellitus, and hopefully everyone is familiar with diabetes or has heard of diabetes before. We're trying to provide for you a foundational understanding for a more empowered journey. If you are at risk for diabetes, or if you have someone or know of someone who is living with diabetes, or if you have a relative that has diabetes, because this is an important illness, and it's really something that we're seeing in all aspects in healthcare. So let's start with a simple introduction of what is diabetes mellitus. So diabetes is a condition that occurs when the blood sugars or glucose levels are too high in the bloodstream. And where do we get this glucose or blood sugars? We get it from the foods that we eat. And why does this happen? This happens because you have a little organ that's magnificent that is in the lower, under the stomach and the lower end of the stomach, and it has beta cells on it. And these beta cells are like the worker bees of the body, and they produce this amazing hormone called insulin. And insulin is just absolutely the most important, one of the most important hormones of the body, because it actually helps us stabilize our blood sugar so that the sugar that comes from the foods that we eat can go to the cells and we can use it as energy, because the cells need to be fed, right? It's kind of like your car. If you're going to go somewhere, you got to put a little gas in it. So it's the same way. And when insulin, so insulin is sort of like a vehicle. It picks up, it runs to the bloodstream when the blood sugar is high or the glucose levels are high. It picks up the sugar and then it opens up all the cell doors and distributes it evenly so that everyone gets a little bit of that energy that is necessary so that their body can continue to function. And the body is just miraculous, is it not? So it is a very special thing. Why do some people get diabetes mellitus while others do not? A lot of it has to do with risk factors. And I haven't listed everything because I don't want to overwhelm you with too much information. I really want to get your questions and hear your stories and experiences, but we're going to look at a few of them. So when we're looking at risk factors for diabetes, we are looking at age. And believe it or not, the age has been lowered from 45 when I first started diabetes education, which was over 20 years ago. That's my biggest role. I'm a diabetes education care specialist. And now it's 35. Ethnicity, that's a big one, because if you're like me, who's Latina, or you're African American, or you're Asian Pacific, or you're Native American, then you are at higher risk for something like diabetes. If you're living with a little extra weight, and that's pretty much all of us, because we're never going to be able to weigh what we weighed when we were in high school. And sedentary lifestyle also plays a part of that, because typically if we're living with a little extra weight, we tend to be a little extra tired, and so we tend to sit more, unless you're Audrey, who just goes like the ever ready bunny. uh, Family history also, can you imagine, grandparents that had diabetes, siblings that have diabetes, parents that had diabetes or have diabetes, gestational diabetes. For women, particularly if you've had a pregnancy, we are all at risk for gestational diabetes. So that's another reason why someone may or may not develop diabetes. And medications, which is one of the reasons why we're here today, right? Because a lot of medications that have to do with treatment for cancer survivors or individuals that are living with cancer presently can increase your blood sugar levels. And so that's really an important piece. And illnesses like polycystic ovary syndrome or high blood pressure or high cholesterol. So you can look at the risk factors and you can kind of figure out which ones really relate to me. And then we go from there. So now causes and types of diabetes. And I do have a period for you to ask questions. I just wanted to sort of put the information out and keep your questions in mind so that at the end of the slide presentation, you'll have a few minutes to ask me whatever it is that you'd like to ask me. And WellBetic is happy to support any journey that you're on, really. This is something that we do because we love it. Causes and types of diabetes. I only picked a few of the more common ones because diabetes is evolving. Every day, depending on the scenario, there are individuals that might have characteristics of type 1 and characteristics of type 2, and we may have a different name for them. There are new diabetes diagnoses that we are actually having to determine because of the presentation of the scenario that the person is in. But these are the more common ones. And so when we talk about type 1 diabetes, many of you probably remember that as being juvenile diabetes. This is the autoimmune disorder. This is the type of diabetes that really is related to your body actually destroying your beta cells and turning on the beta cells so that you're not able to make any insulin. These individuals must live their life with insulin at all times. And what's important for them is that they need to make sure that they are quickly diagnosed, because this can be a type of diabetes that can create a very scary scenario for them. And about 5 to 10% of the population has type 1 diabetes. But keep in mind that no longer is type 1 diabetes a childhood disease. We now see young adults and we see mature adults developing type 1 diabetes, believe it or not. Type 2 diabetes is the one that we're all familiar with. That basically incorporates about 90 to 95% of the population. And these are individuals that are typically 35 or older. And these individuals, often it's related to lifestyle, but it's also the characteristic that is most prominent with type 1 diabetes is insulin resistance. And insulin resistance comes from many of those risk factors that we just went over, like your age, living with a little extra weight, sedentary lifestyle, those types of risk factors, being on medications or having high blood pressure, high cholesterol, living with cancer, all of those things are risk factors for type 2 diabetes. Then we have gestational diabetes. This occurs during pregnancy, typically between weeks 24 and 28 of the pregnancy. But you do see some individuals developing gestational diabetes, or I should say women, um, later after the 28th week of gestation. And then, of course, medication-induced diabetes, which is more what we are talking about here in this environment. We are talking about having to take medications that potentially increase our blood sugars. And if we have additional risk factors, then our risk is even greater. What do they have in common? It's all about having too much sugar in the bloodstream, which can eventually create serious health problems. For example, blindness, a heart disease or a heart attack, kidney disease, nerve damage, circulation problems. There are so many, and everyone's diabetes is different. So you have to educate yourself. Educate, educate, educate. I'm an educator at heart, and I cannot stress it enough. It should be the entry point of any diagnosis that you receive. Learn about it, learn about the medicines, learn about how it works, and learn about what you can do to keep yourself from moving forward with some of these preventative measures. So let's talk about symptoms of diabetes.
I wanted to get a little clarification about medications.
Mhm.
Am I understanding you saying that there are blood pressure and cholesterol medications that can contribute to blood sugar
Yes,
levels?
yes.
Okay.
That can increase your blood sugars. However, what happens when you have this conversation with your medical provider is you talk about what are the benefits and what are the risks, and sometimes the benefits outweigh the risks. So there are many, many individuals that are on cholesterol medications because they have to be, because their risk of a cardiovascular
Yeah.
problem, heart attack is greater. So, but knowing that allows you to maybe make some lifestyle modifications. And that's what WellBetic is all about. We are looking at holistic education. We are looking at the entire person. We want to get to know who you are and what is happening. And we're also very mind body connected, because what we think about, what our emotions are, whether we sleep, what the stress level is in our environment, all of those things impact illnesses. They impact our blood sugars, they impact our blood pressure. So I can't stress it enough. Education is key. And at WellBetic, we're happy to help you navigate that journey. And yes, you are correct. Uh, Individuals have to advocate for themselves every single day, because the way healthcare is changing and evolving, it's really become important for us. Okay. Sleep, you just put sleep and stress absolutely increase your blood sugars. But we can go on and on. So let's finish the presentation, then we can get on to some of the other questions. So symptoms of diabetes, okay? And again, symptoms for everyone can be different. What is a symptom for some people that's very classic, that's something that they get all the time, and not necessarily be the symptom for another person. So we talk about severe thirst. When we're an adult, severe thirst, sometimes we justify it. Well, I'm thirsty because I'm running to the bathroom all the time, and it becomes a cycle. But if this was a 5-year-old and they were severely thirsty all the time, we'd get them to the pediatrician right away, right? So we have to be our own best advocate. Frequent urination, again, you're drinking a lot of water, so you're going to the bathroom a lot. So again, justifying some of the symptoms that can be related to something other than diabetes. Increased hunger. When our blood sugars are higher and the sugar is just in the bloodstream, we get hungrier. Okay, it stimulates because there's no energy in the cells. The sugar is hanging out in the bloodstream, hasn't gotten into the cells. So the cell has no energy. And in order for us to have energy, the one thing that we need is food. Then we have blurred vision. For some individuals, if their blood sugars are high enough, and we're talking probably blood sugars that are rising at 200 or higher, where you're really going to distinctly have some of these symptoms, and the blurred vision can actually be scary. Fatigue. Many people will say, I'm very fatigued. I'm sleeping all the time. I can't seem to get enough rest. Slow healing cuts. As we know, when we have higher blood sugars and the cells aren't being fed their energy, then our healing process is disturbed. And then last, it can be also infections. So sometimes I used to be in the field of OBGYN. That's where I started many years ago. And we used to have women present with frequent yeast infections. And that was the first indicator of us saying, okay, let's get some blood work and see if possibly diabetes is something that is happening. Okay. So why should cancer survivors or individuals that are going to current treatments for cancer or living with cancer learn more about diabetes? The answer is because cancer treatments, chemotherapy, steroids can raise blood sugars. And that is why we need to learn about something like diabetes. Sometimes you hear diabetes with cancer survivors or cancer patients being diagnosed as secondary diabetes. And sometimes that's reversible, but not always. So steroids, inactivity, weight gain, that also increases your risk. So you need to learn how that impacts your blood sugar. And education, again, can't stress it enough. That's what helps you with prevention and with preparation so that in the end, you are empowered to continue to have long-term health. Being informed empowers long-term health. When we don't have the information that we should have, when we are feeling like we're not sure why we're taking this medication or the other, or we're feeling like, why am I making these changes to how I live my life because they don't seem to be working for you, then you have to ask questions. You have to get education. You have to seek out that information from someone who's willing to give you what it is that you need. Because once you find that, then things start to fall into place and you start to learn how to keep yourself healthier. So how can I lower my risk? Again, education, absolutely. Healthy, mindful eating, not just selecting foods that are healthy for you, but being mindful about how you eat your meals. If you are, swallowing your meals in 2 minutes, if you are, eating, I sometimes have a lot of medical physicians that shadow me to learn about how we approach diabetes education. And they will be running from one clinic to another, eating their lunch on the way there. Okay, that is not healthy, mindful eating. That's stressful eating, and that increases blood sugars. Movement and physical activity. Move more, sit less. Yeah, we shouldn't even been sitting for an hour right now. We should be up and we should be moving and we should be burning some of the sugar that is coming from the foods that we're eating. Stress management, also a big one. Stress is very risky for all illnesses. It increases blood sugars, blood pressures, it increases cholesterol, it increases all kinds of physiological responses of the body that can really create some major problems for all of us. Try to maintain a healthy weight and good blood pressure. Okay. And then staying curious and staying informed. These things are really, really important. And there are many others. And again, everything is unique to you as a person. When I see someone individually, I am focused on what it is that you are bringing to the table, where it is that you want to go with things, and how can together we bring you there, because everyone's journey is always different. We doing all right?
We're doing great.
Okay. So now let's talk a little bit. Okay. Your voice matters. This is what we're here for. We are thriving woman to woman conversations. That's what we're having. So let's dive into your thoughts, your experiences, your questions. You know, this is about you. So please ask me questions.
Sleep and stress are major concerns.
Absolutely. And they will impact your blood sugars.
Right.
Everyone should be striving for at least 7 to 8 hours of restorative sleep every night. That's going to be in that handout. So it's really important. If you can't upload that handout that's in the chat, Rachel is going to be emailing it to you, because I want you to have those 8 tips. They're very, very important.
Thank you. Who else out there has some questions or comments, or just perhaps some you're wondering about something that would help you?
Yes, hi, Dr. Stroke. Thank you very much for such an interesting conversation and session. I wanted to ask about our older patients who are receiving treatment. So some will say it's too much to check blood sugars all the time. How can you recommend perhaps stratifying like the times when they can check the blood sugars?
Sure. So I really think it depends on what their treatment plan is. If they are on oral medications, then they should negotiate with their medical provider, perhaps testing, sort of varying their testing. So testing first thing in the morning just to kind of see how you did overnight, and then testing 2 hours after a different meal. Like I tell patients, test 2 hours after breakfast for like 3 days, just to kind of give you an idea, certain breakfast foods and which ones are working for you and which ones, let's say, need to be adjusted a little bit. I don't really restrict anything except for sugary drinks and sodas. They can pretty much have anything that they want. And I even have them, sneak in their desserts, periodically, but I want them to have them earlier. I don't want them having their ice cream at bedtime, because then their blood sugar is high and they're not moving, they're sleeping. So that doesn't really help with bringing the blood sugar down. And then I had them do 3 days, 2 hours after lunch with fasting. Then I have them do 3 days, 2 hours after dinner, and they're fasting, and that gives them a lot of information. Lots of times, if they're on oral medications, that is the best way to gather some information on what is going on with your blood sugar, and obviously having a periodic A1C done, because if your A1C is in the diabetes range, it should be frequently tested, at least every 6 months. If your A1C is in the pre-diabetes stage, then it may be something that you do annually, but you do have to keep an eye on it. There are other options for those individuals that go on insulin, or those individuals that have insurance companies that will cover, let's say, a sensor, which is continuous glucose monitor. And there are also coupons for continuous glucose monitors. The Libre 3 Plus, for example, is one that for $75 to $80 with a coupon from the company, you can have 2. So that gives you 30 days worth of continuous glucose numbers. And that's fantastic. If you can, or if maybe I don't know if you work in an ambulatory setting or if you work inpatient, but like in an ambulatory setting, you could even ask your representative and they can bring in some samples and you can trial some of these samples. I do this with clients all the time. They come in I say to them, I think you would benefit greatly from learning what foods are doing to your blood sugar. So why don't we try a sensor for the next 15 days? The nice thing about the Libre 3, of course, is that it's 15 days where others may be less days. So I want to give them the most amounts of days, and then we can come back and take a look at what happened with their numbers. And that just gives us a fantastic story so that we could really pinpoint, where are you struggling? Are you struggling before meals? Are you struggling 2 hours after meals? Is it your fasting that we're having trouble with, or is it during the night? Does that make sense? Does it answer your question?
Yes, thank you
Okay.
very much.
Oh my gosh, it's my pleasure. Reach out to me anytime. My information is going to come up in the next slide. Thank you. And you had another question? I see your hand is up.
Yeah. So is there anything you can do when you can't exercise as much? Do you just have to be more careful about your timing and all of it? Or is there anything to sort of counter the fact that you can't be, moving around the way you would normally and taking exercise? Because I've read tons online, and almost everywhere people say 10 minutes after you eat, get up and walk around. And that will, really help you with your blood sugar levels. I can't do that, but I'm thinking, is there something else I can do that, after I eat?
So 1 minute is better than 0 minutes. So whatever amount of time you can commit to some upper body movement, it can be straight arms up and down to the side. It can be head down and up. If you do okay, it can be twists. It can be circles, small circles and larger circles and bigger circles. I mean, there's so many options, but do it as often as you can. And if you can't stick to 10 minutes after a meal, then try to every hour do just a few minutes. But anytime you have an opportunity to move more, move more.
Okay.
Water is also very, very important. And one of the things that I'm going to stress, laughter and happiness. Audrey and I
Yeah.
wholeheartedly believe in this. We have individuals that we know who have no diabetes, but they're always happy. They're always listening to comedy, and they're always cheerful. And, what we think about, what our emotions are, staying in the present, doing something that you love every day. Like people do meditation, people do dancing, people do gratitude, they do journaling. If you can do something every single morning before you get your day started, if your day is 9 to 5, or at night if your day is a third shift, that just sets you up for a much better day, much better blood pressure, much better blood sugar, much better you.
One of the things for me is there are a couple of online places with cats and dog stuff that, that's it. I just need 5 minutes and I'm on the floor.
Yes. Yes.
And
Pet
so,
therapy.
yeah.
Absolutely. Yes.
The other thing I would say, in whether it's diabetes or something else, is to focus on what you can do and not what you can't do, because you will lose your mind.
Absolutely. That happy piece, that choosing to have a phenomenal day each and every day, that is up to us. So go out there and get ready to conquer the world, because you can, if your mind is basically set on that. I do meditation in the morning. That's how I start my day. And I know that when I don't have a chance to do it, my day is totally different. But when I do get a chance to do it, things just really fall into place. Even if there's an obstacle, even if there's a stressor, my reaction, my ability to handle it goes so much smoother.
Thank you so much, very much.
It's been my pleasure. It's what I love. It's my passion. It's what I do. I want you to be happier, healthier you every day. So I'm blessed. You've got this. You guys got this. Thank you for inviting WellBetic.
I have a quick question,
Yes.
actually, Marisol. I feel like there's a lot in the news about like Ozempic and the various weight loss drugs that they started as diabetic drugs, and now obviously many people are using them for purposes of weight loss. Could you just talk about those? And again, it's kind of what they are if you're diabetic, what they are if you're not diabetic, and kind of the role, because it's such a hot topic right now.
It is, it is, it is. Yeah, so in a world where we are seeing our obesity levels continue to rise because we are getting more sedentary, COVID did a job on all of us. um, it is really important to be mindful and be active and eat healthy foods. But for some individuals, they need a little bit of a jump start. So many of them are turning to these GLPs and GLPs, GIP medications like Ozempic and Mounjaro. And my personal opinion is that if you are motivated, if you are determined to lose 5 to 7% of your weight, your current weight, it is something that you can actually do on your own, because what these medications do is they slow down your digestion. They help the insulin that is circulating in your body work better. And as a result, you get fuller faster and you stop eating, okay? Or you don't have an appetite, so you eat less during the day. But there's no movement, there's no happiness, there's no hydration, there's no mindset, there's no holistic approach. And if you are someone that wants to jumpstart and wants to try this medication, and there are no contraindications that you can have it, that's totally fine. But you can do this on your own. You slow down how long it takes you to eat every single meal. You chew and you truly enjoy every bite, 20, 30 minutes to have your meal. But we don't have that time, right? And then after eating, movement, very important. While you're eating, water before and after, okay? And all of those things can really give you similar results. They're not going to be as quick, obviously, okay? But there are no side effects to what I am suggesting. There are side effects to these GLP-1 drugs. Some people get a little nausea, some people get vomiting, some people get really bad stomach aches, some people have terrible burping, some people have terrible gas. So there are some side effects that aren't necessarily the most pleasant ones.
In
Does
addition,
that,
if I
yeah,
might add, if I may
yes,
interrupt, at the gym the other day, there was a class that was being given, and the instructor did mention that I knew, but I'm sharing, that those that take the Ozempics and other such drugs long term end up with bone and muscle loss
yes,
that cannot
absolutely,
be regained
absolutely.
anytime soon. So yeah, those are concerns.
And that's true of any medicines that we take. We have to understand what the long-term effects are going to be of those medications based on what side effects you could potentially have from them. So that's a great point, Audrey, because as these medications are being studied over and over and over again, we are finding that they do actually create other health conditions. However, that being said, some people need to be on them because of the cardiovascular disease protection that is sometimes needed for certain illnesses, diabetes being one of them.
Yeah, you weigh the benefits and the risks.
Always.
Called life.
Absolutely.
Called life.
Absolutely. Absolutely.
Well,
So, other questions? Okay, it's been
I know
fantastic.
we're almost out of time, but can you just like briefly, I know you mentioned right at the beginning we were talking about watermelon. Can you just briefly talk, again, for those who are not diabetic, but just,
Mhm.
there's a lot of talk about, sugar and things like that. Can you just really briefly, before we wrap up, talk
Yeah.
just about
I mean,
the role of sugar in kind of, for
every,
those who are looking to
every
not be
yeah.
diabetic? And
Yeah, yeah. There is sugar in everything that we eat. Everything that we eat. Fruit, it has a lot of natural sugars. So if you're trying to be preventative, then you want to have your watermelon with some protein. So I usually tell my clients to cut it up in little cubes and put it into some cottage cheese. Or I'll have them have it with a little bit of a rolled up deli meat. turkey or chicken or, pieces of ham, something that's going to slow down the rise of the carbohydrate, because fruit is carbohydrate, which is sugar. And as soon as you eat a carbohydrate, within 15 minutes, your blood sugar rises. So in order to stabilize and kind of slow that rise that's going up really quickly, that's what you do to kind of slow it down. And the same thing with veggies. When you're eating, you want to make sure that you eat your veggies first, your protein second, and your carbs last. But again, it's different for everyone. So what works for one person doesn't necessarily work for another. So please make sure that you are getting your information from individuals that work in this field and have the expertise, because having a friend say you can never eat rice again because you now have diabetes, that's not true. It depends on portions, and portions are based on what your needs are and your age and what your weight is and what other illnesses you might have. So there are a lot of factors that go into a lot of those care plans and treatment plans. Does that answer the question for you, Rachel? Okay, well, thank you for inviting WellBetic. It's just been such an honor. We are so excited to have had the pleasure of connecting with each and every one of you today. You've got this. And if you don't think you've got it, feel free to reach out to us. Our information is on there. Stay connected, which is great in this Women's to Women's Thriving group. Stay inspired, stay well, and thank you, thank you, thank you.
Thank you.
Thank
so
you,
much.
Marisol. Thank you.
Wonderful. And you're
It was
such a
wonderful.
resource, and you're such a lovely, kind person, and it just comes through. And so any patient would be really lucky to work with you.
Thank
Super
you.
helpful information and really just wonderful. So thank you, everybody.
Thank you.
And Audrey, as always, you know the most wonderful people. So thank you so much. And we will see you all next month. For those who are live, what we do is we alternate a speaker on a topic, and then the next month we actually kind of talk about the topic. So we are really, really excited to continue the discussion. Actually, no, I'm sorry. We are not meeting next month. I apologize. We canceled the August meeting because so many people won't be here at the end of August. We will see you in September. So.
And make sure you get those 8 tips. They will be helpful.
Absolutely.
Thank you.
Thank you, everybody.
Thank you.
Bye.
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 Bye.